Hi, this is Dr. Mark Sehl from the YouTube channel Therapy for the Heart. This is a 49th talk, believe it or not. And this one is on Are we an overprescribed nation? Prescribed means in terms of medications. I have a long-standing concern about this because I've always felt that medications were dispensed too quickly. GPs might see somebody and they might say, I have anxiety and really getting to me, or depression. And they would quickly dispense medication, and not often in conjunction with psychotherapy. So how much do we really know about medications? I mean, we read a list, and all sorts of side effects. It's very confusing. But again, the FDA doesn't release all the information to the general public. How much do we know? Many of the increase in drug use in the United States, and it's tremendous, was based on the chemical imbalance theory. So we have a chemical imbalance, therefore that's why we need medication. Well, that really made the drug companies very happy. $20 billion industry at least, and it also made the psychiatrists happy. I'm not particularly, well, it did, because they turned away from talk therapy and they gave them a significant role because they were the only ones who could distribute medication. Now that's not true, but that was. So let's take a look at the chemical imbalance theory. And I have a quote for you. This is from the National Institute for Mental Health. They noted in 1984 at the conclusion of such investigations, quote, elevations or decreases in the functioning of serotonergic systems per se are not likely to be associated with depression. So why was the public told differently for all these years? Well, mostly academics were consulted about these issues, and not the people who were really involved in the clinical trials. It seems like the whole chemical imbalance theory was convenient to sell drugs like Prozac and other SSRIs, and also made psychiatrists, I said, gave them a significant role in mental health. Prior to the use of these medications like Ritalin, you'll find that researchers reported that manic depression, this is very interesting, manic depressive illnesses, which is what bipolar illness was called at the time, virtually never occurred in pre-pubertal children. But once psychiatrists started putting hyperactive children on Ritalin, they started to see pre-pubertal children with manic symptoms and were eventually diagnosed with juvenile bipolar diagnosis, which they didn't have before. So when you add up all this information, you end up documenting a story of how the lives of hundreds of thousands of children in the United States have been destroyed in this way. In fact, I think the number of children and teenagers that have ended up bipolar after being treated with a stimulant or an antidepressant is now well over 1 million. That's a quote. This is a story of harm done on an unimaginable scale. This is from the website counterpunch.org, and you can go there and look up the astonishing rise of mental illness in America. Irving Kirsch wanted to investigate more about the reports that were not released to the general public, but were published in journals. Significant, wonderful outcomes of these drugs. So he wanted to know what else was not reported. So he got, through the Freedom of Information Act, he got access to the files, and he found out that 82% of the studies said that the placebos that were used in the control studies were as effective as the medication. 82%. They didn't want to release that. You can see why, right? And placebos, what are they? They're sugar pills, and some are given to some patients, some are not, and then they determined what the results of those that distribution is. 82% placebos. So little knowledge is really known about how these chemicals affect our brains, and especially when it comes down to the tiny vulnerable children that are medicated at a very early age. So about that, what's happening to our children? Almost 20,000 prescriptions, 20,000, for risperidone, commonly known as Risperdal, and Seroquel, and other antipsychotic medications were written in 2014. 20,000 for children 2 and younger. A 50% jump from 13,000 just 1 year prior to that, according to the prescription data company, IMS Health. Prescriptions for the antidepressant Prozac rose 23% in 1 year for that age group, 2 years younger. I mean, what's going on? Listen to this. So tardive dyskinesia was found to develop after a brief treatment of Risperdal, just the one that just was mentioned as one of the ones that were distributed to the children, one of the drugs. Found after a brief treatment of Risperdal. As seen, tardive dyskinesia is jerks, sudden jerks, and sudden movements that you have. They're involuntary, and often it happens also when drug dosage is reduced too. That's terrible. What are we doing to our children? What don't we know about what's happening to our children? This is another fact of research. Young animals develop permanent changes in the frontal lobes of their brains after a brief exposure to Prozac. I wish I could remember what it was, but when I was reading the first book that came out about Prozac, I checked a note in the back, footnote, and it said something that was very alarming to me, that there was significant a result of the of people taking Prozac, but it wasn't mentioned in the whole body, at least at that. I read the whole book thoroughly, but that little footnote, and I believe it might have been related to cancer, but I'm not sure. I'm going to go back and find it. Permanent changes in the frontal lobes of their brains after brief exposure to Prozac. What would happen if a longer term exposure? Alarmingly, 300,000 children prescribed sleep aids, and drugs like Xanax and Ambien can cause memory loss and dementia. Dr. Nancy Andreasen, she was a neuroscientist and psychiatrist, and she worked with people who had schizophrenia. She found that there's a loss of brain tissue, some 1% a year. So if you multiply 1% a year over 18 years, that's a lot of loss of brain tissue. So again, what's happening with the people that we're treating? So I hope this information is helpful to you, because sometimes you may not run across it, and that's why I'm doing this therapy talk. Antipsychotic drugs reduce symptoms, but there's a slow atrophy of the prefrontal cortex. That's an important part of your brain. Slow atrophy. Benzodiazepine is associated with 50% increase in the risk of dementia. So many people are on benzos. They take them regularly, and often they get addicted, or they're habit forming. 50% increase in the risk of dementia. That's a big increase. It's a big percentage, huge. There's a boy named Kyle who was reported in the New York Times. Kyle was 18 months old at the time, and he was prescribed an antipsychotic medication. At age 3, Kyle was on antipsychotic medication. He was on antidepressants, 2 sleeping medications, and 1 medication for ADHD, attention deficit hyperactivity disorder. It's incredible. So Kyle was lucky. He had a doctor who eventually weaned him off these medications. But the doctor's remark was, in no way should this boy have been prescribed medication at his age, 18 months. It's found that SSRIs, that's the selective serotonin reuptake inhibitor, has led to suicidal ideas in persons who never had suicidal ideas before. Well, that's great, right? Who never had it before. So this depression, the medication is supposed to help with depression and all the different kinds of mental health problems. It's not doing it. It may be doing it, but also what is it doing? Jonathan Cole, one of the premier figures in the development of American psychopharmacology, he was very against the use of SSRIs and also knew about the increase in suicidal ideation. The FDA was having hearings on this issue. They would not let him participate in that conference. So what does that say? Keep him out, like keep out the bad trials, keep out the people who are really very strongly opposed. The British psychiatrist David Healy has issued harsh criticisms of both the pharmaceutical industry and, in general, and nearly $200 billion a year antidepressant industry in particular. $20 billion a year antidepressant industry. His central charge the manufacturers of Prozac, Paxil, Zoloft, and the other drugs belonging to the family of antidepressants known as SSRIs have deliberately misled the public about both the safety and effectiveness of their popular products. Deliberately misled. Their misinformation. You're getting misinformation. That's what this podcast or the therapy talk and the podcast are in part about, the misinformation that we get, the lack of all inclusivity in terms of what's known and compared to what's being reported. It's terrible. His outspoken approach to this whole issue nearly cost him his job, but was finally invited to the FDA hearing about SSRIs. Here's something about the biggest review of its kind, January 2016, which is fairly recent. It's carried out by the Nordic Cochrane Center and analyzed by the University College of London, who today endorsed the findings in an editorial in the British Medical Journal. I don't know what, that must have been in January, yeah. They endorse, that's the British, the BMJ, the British Medical Journal, is a very, very responsible journal. So this is a Cochrane Center. So this is the review, this is the result. After comparing clinical trial information to actual patient reports, the scientists found pharmaceutical companies had regularly misclassified deaths and suicidal events in people taking antidepressants to favor their products. Regularly misclassified deaths. That's totally irresponsible. Just to protect themselves and for money. It's greed. You're going to misrepresent and misclassify deaths and suicidal events in people taking antidepressants to favor their products. Also, antidepressants were found to double the risk of suicide in under 18 children, teenagers. Double the risk of suicide in people taking medication. So, the medications is all about subduing our feelings, masking them, not getting rid of them. You know, we have depression, we have anxiety. You know, that's not bad. I mean, it gets in our way of living, but, you know, depression, anxiety, they're all means something's going going on in us. Something's happening. That something happens that's important to understand more about. Not to subdue it. People have to learn to live, get tough and learn to be strong and live with their feelings. And it's hard to do because often as children we were taught, as you know, in these talks, that our feelings were bad, that we were bad for having them. Children attack themselves by being not right, not good enough. So many interventions with caregivers have resulted in the idea or to stay away from your feelings, or they're bad. But we have to get tough and learn to live with them. They don't go away. You know, we can put a mask on fear, but fear is going to be there anywhere. So we can run away from it, but it runs right on, so it doesn't go away. It's like if you put your head in the sand, the world's not going to go away. So we need to learn to live with them. And how can you investigate, like the repetition of difficult relationships? So we've talked about that here before, that people repeat difficult, unsatisfying relationships with an unconscious purpose. So if you take away the feelings, it's going to be hard to know what happens and why that happens, because without the feelings, you're going to be more or less numb. You're not going to have a motivation to really investigate those. But that's very important, isn't it? You know, you want to learn why you keep finding men who are not emotional, or men keep finding women who are not available, or maybe critical, or not right for them. Both men and women. Happens so many times that I find in my practice people coming in with that very story, and they don't see the patterns. Why should they? They are unconscious. Sometimes people don't believe in the unconscious. Well, you know, it's been around for a long time. So if you don't believe in it, it's like putting up a straw dog, you know, and fighting it, because it's true. There is an unconscious. So we get lonely. Lonely is not so bad either, because it means that we miss something, miss a connection somewhere. And those missed connections are not going to be understood by taking a medication. Medications, you know, again, they just mask our feelings, you know, and fears. So anyway, you can run away from fear, but fear doesn't run from you. I made that up, but it's true. We need to learn to get tough. It's not always get tough, but we need to toughen up, because what our habitual mode of being in the world is often to not live with the difficult things that are inside us. Look, when I ask patients to meditate, for instance, it's very difficult for them, because the minute they try it, they become uncomfortable. They might become sad or anxious, you know. So they might want to move on the when they're in the prone position. I'm just in meditation away from the office, and move. Well, movement discharges the energy. You needed that energy in order to find out more about yourself. Andrei Tarkovsky, who was a great movie director and producer, Russian, and he gave a talk about the young people in our world and how they're never alone. Never is an absolute, but of course they're alone sometimes. But with paying attention to having the radio on, the TV on, listening to music and other things on with earphones, constantly texting, you know. It's a way to gratify oneself, because it is establishing some connection, right, to others, but often not the kind of connection that you want to learn to develop and live with discomfort in yourself, because it's like, for instance, Instagram, very gratifying. You get a lot of likes, you know, so you can just go on there and see who's liked you, who's liked your post. That's gratifying, a nice feeling, but when it takes up hours of the day, is that good? Is that helpful to your own mental health? In a way, yes. In a way, not. Because the more the preoccupation you have with it, the less attention you are paying to who you are as a person who has significant feelings, anxieties, depressed moments, and learning to live with them, get to know them. There was a person I worked with maybe I'll pull this. This will pull a lot of this together. But he was addicted to crack and cocaine, crack when I first met him, and he wonderful to work with, but he didn't have, as he said, an angry bone in his body. And his mother never really let him talk about anything. She was always, she never came into his world. That's his expression. Never came into his world, meaning she was very narcissistic. She couldn't really pay attention to him. So he developed a way of handling his feelings, which particularly was anger, although it was not conscious of that. And he couldn't talk up to her, so he took medication and got addicted to it. Fortunately, not too tremendously addicted, but he did get arrested, and I helped him out because they charged him with felony, and they said they weren't going to hold up the felony to him, and then when he got into to the court, they did charge him with felony. So anyway, I worked with him, and how I helped him was to be able to express his feelings in the sessions over time, not right away. You can't expect people to do that. It's not their habit. But over time he could, and particularly he could talk about his anger towards me. Now, therapy is really a practicing stage when you can come in and do things that you never can do with regular, people in your life, and you have to take time to get used to it. And it's not easy to tell your therapist, I think your room is really antiquated, or you should get that couch and put it in the cellar, So I eventually helped him do that and tell me these kinds of things. It's a practicing stage where you can practice with yourself and with the therapist so that you can learn things and then you can carry them forth to other people in your life. So eventually he got off of crack, and he told me I could tell this story. He got off of crack, and also he had this brilliant insight that, when I feel angry, I don't have the impulse to use crack because he feels it. He doesn't have to defend it against it, because crack, opioids are anti-rage function. That's what they have, an anti-rage function, basically, among other things. So he got off of crack, and he also got off of a medication. I believe it was Prozac. He's been on for 12 years. He got off of that on his own, and what a change in his life. Amazing. So what about the future of our children? This podcast has always been about children, right? In some ways or another, caregivers' relationships to the children, and how that interpersonal relationship affects the outcome of that child in terms of their own feelings about themselves and confidence, or lack of confidence often. So I've always been concerned about that since 2011, when these therapy talks came out. So this doesn't mean that children shouldn't take medication. Sometimes it might be essential. If a mother or father has a child who's biting them and screaming and unmanageable, they may need some medication to see if they can that kind of violent eruption can be subdued until they can get into psychotherapy. So none of these talks, by this talk particularly, is not recommending that you either stop or begin medication. I mean, this is not. You don't want to stop any medication because of this talk. Not recommended. And I'm going to make that loud and clear, because you need to stop with the help of somebody who's prescribing the medication, who prescribed it, and get off it in a safe way. Like Effexor has been having a reputation of having violent behavioral reactions if you get off it cold turkey. Other things too. So this is an informational video to try to help you see what you might not know and what you can look for. Like, for instance, if parents you're considering medication for your child, you really want to know the research in depth. If you don't like the opinion of the doctor who's giving you that suggestion, you can get another opinion. You can look, if it's a new drug, you can look at the research that is available for older children and see how the effect of that and the outcome. So I hope this has been helpful. Again, I'm recommending living with your feelings, and if you haven't been tough with yourself, try to go to therapy and be different, rather than avoid things. Sometimes you have to avoid the things, but you don't. Sometimes you think you have to avoid them, but when you try, and try therapy, and you live with you try to trust, to coming to us. It's hard to people come to therapy because you've been betrayed so much and hurt so much that why shouldn't that happen to therapy sometimes? But you've seen many of my broadcasts and the YouTube videos. You kind of know what I'm like, kind of. Well, I'm saying kind of. Do you really know? But you get a good sense, hopefully, with 49 videos of them. So you can do that. You can check out other therapists too with their videos and see a few people if you're thinking about going into psychotherapy. But thanks for listening. This is Dr. Mark Sehl from the YouTube channel Therapy for the Heart, talking about Are We an Overprescribed Nation? And I hope you can like this talk if you like it, and if you want to subscribe, get an email account, a Gmail account, and you can subscribe and make comments because I will respond to them as much as I can. So you can text me at 917-991-9113. Visit my website at marksehl.com or email me at marksehl@gmail.com. So I will be back again. Nice to be here. It's always nice to be talking about things that are important to me and hopefully important to you. All right, bye-bye for now.